Tell us about yourself.
Thank you for the opportunity. I am a registered nurse with experience in critical care, managing ventilated and hemodynamically unstable patients. My clinical background includes sepsis management, vasoactive infusions, arterial and central line monitoring, post-operative cardiac, and medical ICU patients. I practice with a strong focus on patient safety, early recognition of deterioration, and multidisciplinary collaboration. I am committed to evidence-based care and continuous professional development, and I am keen to contribute to high-quality critical care services within your hospital.
A ventilated patient suddenly desaturates to 85%. What will you do?
I would immediately assess using ABC approach. First, check airway, confirm ET tube position and patency. Second, assess breathing, check ventilator disconnection, obstruction, secretions, lung sounds. Increase FiO temporarily. Suction if required. Check for pneumothorax signs or circuit malfunction. If no immediate improvement, I would call for urgent medical review and prepare for possible escalation, while documenting all interventions.
How do you manage septic shock?
I follow the sepsis bundle. Early recognition. Blood cultures. 4 broad-spectrum antibiotics within 1 hour. Fluid resuscitation, typically 30 milliliters per kilogram crystalloid. Lactate monitoring. Maintain MAP greater than or equal to 65 millimeters of mercury. Start vasopressors such as noradrenaline if fluid refractory. Continuous reassessment is essential.
Explain how you interpret an ABG.
ISS. pH acidosis or alkalosis. PaR-CO respiratory component. HCO metabolic component. Compensation. Oxygenation status. For example, pH 7.30 with high PaR-CO indicates respiratory acidosis.
How do you prioritize care for 2 unstable patients?
I prioritize based on immediate life-threatening compromise. Using ABC principles, I stabilize the most critical airway or circulation issue first. I would call for assistance immediately and delegate appropriately to ensure safety for both patients.
How do you manage a patient on noradrenaline?
Noradrenaline should ideally be administered via central line with continuous arterial blood pressure monitoring. I titrate according to prescribed MAP targets, monitor urine output, lactate levels, peripheral perfusion, and cardiac rhythm. If escalating doses are required, I escalate early to the intensivist.
Tell us about a time you handled conflict.
In one situation, there was disagreement regarding escalation timing. I respectfully communicated my assessment findings and clarified my concern regarding patient instability. We reviewed clinical indicators and escalated appropriately. The situation was resolved, and patient safety was maintained.
What would you do if a doctor ignored your concern?
If I believe patient safety is at risk, I would escalate respectfully through the appropriate clinical hierarchy. I would document my assessment and follow hospital escalation policies.
What do you know about nursing standards in Australia and New Zealand?
In Australia, nursing practice is regulated by the NMBA under AHPIA, which outlines standards for practice including accountability, scope, documentation, and mandatory reporting. In New Zealand, practice is regulated by the Nursing Council of New Zealand, which emphasises competence standards, cultural safety principles, and professional accountability.
What does cultural safety mean?
Cultural safety involves respecting patient identity, beliefs, and values, and providing care free from discrimination. In New Zealand, this includes understanding Maori health perspectives. In Australia, This includes awareness of Aboriginal and Torres Strait Islander health contexts.
How do you manage stress in ICU?
I stay organized, prioritize tasks using clinical frameworks, seek early support when required, and reflect after critical incidents. Maintaining emotional resilience ensures safe patient care.
Why should we hire you?
I bring strong clinical judgment, calmness under pressure, and a safety-focused mindset. I value teamwork, clear communication, and evidence-based practice. I am adaptable and committed to maintaining high professional standards aligned with your organization's values.
Why do you want to work here?
I am drawn to your hospital's reputation for high clinical standards and collaborative culture. I am particularly interested in contributing to a team that values patient safety and continuous improvement.
Do you have any questions for us?
Can you please tell me about the nurse-to-patient ratios in ICU and how acuity is allocated? What orientation and support systems are available for nurses transitioning into your ICU, especially for internationally qualified nurses? What professional development or postgraduate critical care opportunities does the unit encourage?